Hello again. For those just joining, we're just going to wait another minute or so to allow for more people to trickle in, and then we'll get started. All right, good evening, everybody. My name is Chris Pollock. I'm the Director of Communications and Marketing here at Wells. I hope you guys are well and safe and healthy, and that your students are excited to return to Aurora in just a few weeks, or if you're a first-year student, welcome. We're looking forward to having everyone back, and I want to thank you so much for attending this session. Although this year at any college, including Wells, is going to look a little different, I just want to assure you that it will still be a great year for everybody. As with other colleges and institutions, we'll be taking a number of precautions, including wearing masks, social distancing in the dining hall and the classrooms, as well as combining traditional face-to-face learning with digital and remote delivery. Most of the things that will be present on campus should be familiar to you by now from other parts of society, whether it's restaurants or businesses. But we're going to talk a lot about that tonight, and also talk about the arrival and screening and testing and how that will all work. But above all, we're going to support one another. We're going to care for one another and respect one another as part of the Wells community. It's a tradition that we've had for many, many years, and it's not going away anytime soon. You're welcome to put questions in the chat during the presentation. We will try to answer them either within the chat or during the presentation. And after the main presentation, there will be an opportunity for a full Q&A. So with that, I'd like to turn things over to President Gibraltar.
Thank you, Chris. Welcome, everybody. It's really very much appreciate that you've connected with us. It means a lot to us that you have such a strong interest in understanding what collegiate life is going to be like this year. And it's so important that you understand that we're very fortunate in New York State because of the leadership of our governor. The rate of infection in New York State is amongst the lowest in the country. Because of the current rate of infection, and because of the fact that 70% of our students are from New York State, we feel that we can do a really good job in containing the spread, keeping COVID out of our community, and assuring everyone's health and safety. The word community is really key. The word social responsibility is critical to us coming together as a community and helping and supporting each other. The first thing that I'm going to ask you to do is go to our website and read our plan. It's been many months in the making. It's incredibly detailed and includes all aspects of campus life, including resident living and dining services. It includes activities and everything that we need everyone to comply with. Want to let you know that there will be regular testing, that we're asking our students, if possible, to come to campus already having been tested, and that we will be having daily screening and, if necessary, contact tracing. But Dean Kenyon is going to go over all of that in greater detail. My goal is just to say to all of you, please read the plan. Please ask questions now, because there may be questions that we haven't thought of, and we'd rather have them made now so that we can give them some thought and make sure that you have answers. And please stay in touch with us, all right? Because I know that you are concerned, as we are, and we want to make sure that we're responsive and here to help you through what is likely to be a stressful time. For those of you whose students were here last year, the world changed very quickly. There are things that we're going to be asking of students that have become part of everyday life. And in so many ways, this is going to be about social norms. People wearing masks, socially distancing, washing their hands, everything that you've been experiencing every day of your life since March. We know there are going to be mistakes. Come on. How many times have you gotten out of your car and gotten halfway to the grocery store before you realize you forgot your mask? And our community is going to be such that when we see people make those mistakes, we're going to politely ask them to go back and get their mask. So with that, we're looking forward to welcoming your student to campus. We're looking forward to making sure that you feel comfortable with our plan. And I'm going to turn the program over to Dean Kenyon, who's our Dean of Students. The students sometimes call him Dean Charles. And several others of us are going to also bring you up to speed as he's speaking. Please put questions in the chat. We'll try to answer them as best we can. If we don't get to answering them today, we are using them to put together a list of frequently asked questions that will also be posted to our website. Thank you very much, and Dean Kenyon, take it away.
Thank you, President Gibraltar. And I do want to talk with you about our plan for compliance with COVID-19. It's created some challenges for schools across the country. And I'm hoping I'm able to make a slide advance, because that would be helpful. As President Gibraltar said, our plan really focuses on an emphasis on personal responsibility. We have an honor code that students have observed for years, over 150 years. We're adding to the honor code the community care pledge and an expectation that everyone in our community will monitor their daily health and make sure that they're staying home and seeking medical care if they feel ill. This community care pledge is really a commitment to be responsible for yourself and to act in ways to minimize any threat of harm and help the spread of this coronavirus in our community. Aurora is a small village. Wells is a small college. We have the capacity to work together to contain this virus in our community and keep this place safer than even the town or village where you might be sending your children to us from. So we're asking everybody, faculty, staff, and students, to make this pledge, to follow our guidelines, and to do what we think is best to keep our campus safe. So this is part of what the reopening process involves, students taking the pledge. You may have noticed that we're asking students to test before they leave. And that's because in the event your child tests positive, we want the child to stay home with you so that you can provide any care or support that they might need. They can take classes starting August 31st, even from home. So the test result of positive shouldn't stop them from making progress academically. We're prepared for that. And that leaves you in charge of their care while they're home. It also gives us more confidence that they're coming to campus negative for COVID. But we will be testing everyone when they get here. That's to give us a baseline on our campus community. It allows us to know where we stand with everybody. If the student's coming from an out-of-state location that New York has identified as a hotspot, we have a quarantine location in our Dodge North Residence Hall. It's a 14-day requirement from entering New York. So if you arrive here on the first day, we'll provide you with 14 days of accommodation in Dodge North. It'll be lovely accommodation for that quarantine period. We're also in our prevention plan focusing on screening every day, masks wearing indoors at all times, outdoors whenever you're near people. So all of these are things you've heard and seen already in place. So our prevention plan includes quite a bit of hygiene, cleaning, and disinfection practices. You're going to see hand sanitizers widely across campus. Our building and ground staff will be disinfecting and cleaning restrooms and commonly shared areas. If a person does test positive, we'll get into any spaces they've utilized and make sure those spaces are disinfected according to the CDC requirements. And all of this will be explained in signage that's going to be spread around campus so people will know what they're supposed to do. Our plan for prevention includes bringing people back in small groups, what we call a phased arrival, starting on Sunday and Monday through next Thursday. Our student leaders, out of state and international students, will be arriving according to a schedule that has them come in small groups. We'll have new and first year students arriving on August 21st and 22nd. Returning students, many of you in this video call, returning students get to choose whether to come back on Tuesday, Wednesday, Thursday, or Friday in order to keep the groups to a social distance small group each time people are moving in. All of that's set to have you here for classes to begin on August 31st. Now, you've probably gotten our message that we allow one guest to help with move-in. That's to allow for low density in the residence halls. We're trying to limit the amount of contact people have with each other. One guest at a time. So if there's 3 or 4 family members coming with a student to move in, well, one at a time, you can check out the room, you can help make the bed, put up the knickknacks and post things on the walls, but one person at a time is what we're asking for. So a phased arrival. Our prevention plan includes a lot of personal protective equipment. We mentioned the face masks, the hand and sanitizers. We have face shields or additional PPE as needed for labs or studios or any special circumstance. So the students will see some adapted operations in all areas of campus, especially in the academic area. And I'll invite our provost, Cindy Speaker, to talk a little bit about the academic adaptations.
Thanks, Dean Kenyon. Good evening, everyone. In terms of the academic adaptations that we've made, we definitely are asking faculty to be as flexible as possible in their course design so that they can accommodate students should students need to be absent from classes because of illness or if they need to be isolated or quarantined. So faculty will be making arrangements with students so that that can happen so that they can continue with their coursework if they're physically able to do so. We'll be able to provide technology support should a student need to be in quarantine, either on campus or off campus, or have to go home to make sure that they can stay connected to the college. In particular, we've asked faculty to have non-punitive attendance policies. And what I said to the students last night during the session was, what that means is that it doesn't mean you can just not go to class when you don't feel like getting up for your 10 o'clock class, but it means that if there's a reason that you need to miss class, either because of health or family issues, that won't be held against you. We're working very hard to minimize density across campus. So I was working just actually today with our registrar's office to look at classroom assignments in terms of enrollments in each class, the flow of classes. So we're trying to minimize how many classes are ongoing at the same time on any one particular floor of a classroom building so that come the end of that class time, you don't have a rush of people going into the hallway. So all those types of things are ones that we're really looking to modify how we do things to make things as safe as possible for students. Our library will be changing how it's functioning so that rather than having primarily hard copy reserves, reserves will be moved to an electronic format and be available to students via Moodle. All faculty are required to be using Moodle, which is our learning management system, so that they can share information with students. The course reserves will be there. They can make sure students are aware of their grades and so forth. Our library also, which if you haven't been in our library, I would encourage you to do so next time. This building. It's very open, full of light, but because of the nature of the virus, we are going to be closing stacks. So stacks won't be open to students. Students will have to ask the library staff to get a book for them from the stacks. And currently the library staff is making adjustments to the physical layout of the library so that social distancing can be maintained and services can still be provided to students, but being very mindful in terms of who's touching materials and so forth. We've asked faculty to limit field trips, to only use them if they really are necessary to achieve the learning objective. We've asked them to limit guests on campus, so if they need to have a visitor come into the class in order to provide that hands-on or real-world experience, if that person can present virtually to the class, we would prefer to have it done that way. Again, being mindful of how many students are using materials. So labs will be smaller, studio art classes will be smaller in terms of just the number of students sharing materials and being in the space at any one time.
Cindy, there's a question about library student employment. Are there going to be any student employment positions in the library specifically? Do you happen to know,
definitely.
or does Linda know that? Okay. And then another question about on-campus employment in general, wondering when jobs will be posted. I do know they will be posted in the next week. Our HR unit and Linda Galbato are working very hard on that. So yes, there will be work study this year. In some cases, the positions won't start until September 7th to allow for this transition period to end, you know, with quarantine and things like that. So please continue, thanks.
Thank you. So along with academic adaptations, we have some adaptations in the residence life area. Emily Burt, Director of Residence Life, would you like to describe what some of those look like?
Sure, I can go over that. Welcome everybody. So a few things that will be different for students coming back this year will be once upon arrival, all students will be tested for COVID. We do have strict scheduling options for that. So returning students should have received an email yesterday from me regarding move-in dates and times. We are offering them the 25th through the 28th in the afternoon mostly, as that's when we can have students tested. So if a student is requesting to come in to move in outside of those times, they'll have to wait till the next day to get tested. While students are waiting for their test results, they will have to self-quarantine in their rooms. So meaning they're pretty much in their rooms, they can come out to get food, we'll make sure food is provided for them. Anytime they do come out, similar to what the rest of the year will be, they'll need to be masked, just going, you know, to the bathroom or wherever they need to go and then coming right back in. Once they have the test results and it comes back negative, they would be able to, you know, be in the lounge spaces, things like that. Still wearing a mask, socially distanced, that sort of thing. Roommates are considered a family unit, so anyone assigned to a residence hall room together are able to be in that room with each other only with their face masks off because they're going to be in that same room a lot, so they are considered a family unit. Any social gatherings must be approved and comply with social distancing face mask rules, so any RA programming, student activities, all of those things will still be happening, but just they'll look a little different. So, you know, that means that, you know, no just hanging out in somebody's room all together, having your own social gatherings, things like that won't be allowed. And so visitors are only allowed in the lounges, no overnight guests. And so guests do include students. So if you're not assigned to someone's room, you're not going into that residence hall room, but guests from other buildings are encouraged and allowed to hang out in the public spaces, in the lounges, but again, with face masks and socially distant.
Thank you, Emily. So Chris, unless there's any questions you're seeing related to residence life?
No, I think you can continue.
Then in our dining hall, we're going to be having to enforce capacity limits. There are rules for restaurants operations, and so we'll have about half as much capacity in the dining hall at all times. So we'll be putting students in groups to try to provide shifts for going into the dining hall and make sure everyone has a scheduled time when they can have their meal that works for them, but also allows us to keep the capacity at a level that's approved by the regulations we have to follow. We're going to have a lot of meal to go options. Students can call ahead or email ahead what their order ahead what their options requests are. They can pick it up at the dining hall or the well. We'll have extra seating outdoors in the Ryerson Commons. And if any students having to put in isolation or quarantine, they'll have their meals delivered as part of their meal plan program. So dining services is making adaptations, but they'll still be providing full service for all students throughout the semester. We have some changes in athletics that our athletic director, Mike Lindberg, should discuss.
Thanks, Dean Kenyon, and welcome everybody. Looking forward to getting started in the next couple of weeks with our opening for students coming in. Our orientation program is going to keep everyone busy and hopefully informed and engaged. One of the changes that we've had to deal with, and I'm sure if you've been reading the news about athletics, is that all of Division III and Division II athletic programs essentially have decided not to compete in their fall teams. That does not mean that we will not be participating in athletics. We will be doing some, our teams will be engaged. They'll be involved in practices, they'll be involved in team activities, community service, hopefully, but it's all going to be phased in, very similar to how we're phasing in academically. So what that means is students will come in no earlier than other students, which is different. Usually our student athletes, our fall student athletes, arrive a couple of weeks before classes. This year they'll be arriving when they've been assigned to arrive. Practices won't begin, or at least our first meetings won't begin until after September 1st. All students will need to still complete their health report forms. They'll still need to go through all their NCA compliance. They will still need to do their baseline testing for concussions and provide other healthcare information before they're cleared to participate. And so we're in the process of planning what that looks like. Like I mentioned, it's going to be phased in. So essentially that means we're going to start with individual skill development, pods of about 10. Everyone's going to be socially distanced. And then as we see how things fall out and how we progress as a community, within a couple of weeks, we may be able to get into some full team practices and other types of programs. But we won't be playing against outside competition this fall. We're not sure what's going to happen for our winter teams. That's a national question. As far as when they're going to be able to start competing for their games. We have basketball usually will be starting October 1st. Swimming will be starting around the same time, but as far as who they compete during the fall semester, that is still an unknown, and we're going to continue to monitor that situation on a daily basis, quite frankly. Recreational activities, we're making some modifications. We think recreation, physical activity, it's very important. And though the New York State hasn't allowed fitness centers and gyms to open yet, we're making some modifications to provide that service outdoors. So we will have some, our fitness center will be relocated essentially. We'll be using the outdoor facilities to help with that. And those times will be open and will be published in the document that Chris has been keeping very current. We want folks to take advantage of our lake, and we will be opening the boathouse during specific times. Access to the boating equipment, kayaks, canoes, will all be available for checkout. And clearly we have a lot of beautiful trails and other things that will encourage students to go on hikes and things of that nature. And again, the emphasis that you're going to hear throughout this presentation, if you haven't heard it in the last couple of months, is wear your mask, okay? Stay socially distanced, wash your hands. Okay? So our physical education programs, we're also going full bore with some alterations on how they're going to be delivered this year. Some of our yoga, dance, martial arts, those will be somewhat of a hybrid, where we'll be doing some face-to-face and some virtual. Actually, what was really cool is that scuba is okay, and we have a full class for that, and horseback riding is okay, and we have a full class for that. So we're really excited about what we're able to offer students and by way of recreation activities and our physical education programs. So our coaches will be in touch. If your students are interested in participating in sports or are already on a team, our coaches have been and will continue to be in touch with your students about any changes and when practices are and when our meetings will be. And they're always there to support your students in terms of their academic and personal development. So if you have any questions, I'm happy to answer them on the chat. If you have any questions about orientation, I'll be happy to answer those on the chat. But I wish you all well, and I'm looking forward to seeing you in a couple of weeks.
And Mike,
Thanks.
we have a couple of questions about athletics from the chat. One of them is from Lauren. Why are teams not allowed to engage in practices when club teams are playing throughout New York State, as Cuomo has approved many sports?
We're not there yet, Lauren. That's the thing. We're bringing in students from all over the country, okay, to a location, and many colleges are doing the same thing. And so we're going to take this very slow. And all of Division III and all of Division II conferences and institutions have decided, for caution and safety and health sake, it's best to go with no outside competition at this point. That doesn't mean we're never going to do it. Clearly, if the science and the data allow us to, okay, and there's somebody out there that we can play that's still playing, it's something we can give consideration to. But we're going to take this slowly. We're going to take a look at the data. We're going to work with the science. I'm sure you've all heard that line. But our main concern right now is the safety and the health of our students, and working with what we know, not what we hope to know.
Great, and I know you've sort of partially answered this next question, but from Paul, do you foresee the possibility of competitive games with any local teams in the near future?
It's a possibility, Paul, okay, and it's something that we're not excluding. Again, as I mentioned to Lauren, it's something we're going to take slowly, and it's something that when we were first discussing how competition might take place in the fall, we were actually looking at exactly what you were talking about, which is a regional competitive conference, so to speak, without lack of a better term for conference. So taking a look at schools within our hour and a half radius and monitoring them, they're monitoring each other. Is it safe? How can we conduct this stuff? So there was some initial groundwork done with that, but then for the sake of safety and health, and until we can become more certain about what is happening in the sport industry right now, we've decided to put competition on pause. Okay, and that's probably the point, the word to be emphasized. We're on pause, and we're going to continue to evaluate each day.
Great, thanks, Mike.
Thanks, Chris.
Yeah, Charles, back to you.
Yes, thank you for that thorough report, Mike. One of the other features you must know already about Wells College is our traditions are strong. They've kept our community together for over 100 years. We're going to continue to carry out these tradition celebrating events, but we're going to be creative with students to develop ways to hold odd even competitions and the activities of traditions with social distancing, keeping limits of spacing in rooms at the capacity that are required, face masks, all of these elements of the COVID era will be part of our planning for traditions for this coming academic year. And students will be very helpful in planning those events. The Centers for Disease Control has provided a list of medical conditions that place people at a higher risk of catching or having serious illness due to COVID. And so we are offering accommodations for employees, but for students as well. Students who provide medical documentation and self-identify can request accommodations related to COVID. I thought Emily Madison might talk a little bit about that process.
Thanks, Charles. As Charles mentioned, as Dean Kenyon mentioned, any students who have a high-risk medical or disability-related condition can work with my office to receive accommodations potentially for remote learning in some form. Other related requests from students to pursue some type of remote learning primarily will be evaluated on a case-by-case basis with my office. And I'll be working directly with each student who makes those requests to determine what that will look like.
Thank you, Emily. So our plan does require a considerable amount of screening and testing. That's the only way we can know how our campus is doing at containing the spread of COVID within our community. So the screening and testing is important to our practice. Every day, everyone who comes to Wells College, students, faculty, staff, visitors, everyone has to go through a screening protocol. It's a cell phone app that is easily downloaded to a cell phone or a laptop or a computer. It asks you a few questions about whether you've had any symptoms or exposure, and those questions lead to either a green cleared to go to work or class, or a red telemedicine visit recommendation. And if you report symptoms that suggest you need a telemedicine visit, you'll be connected with a healthcare provider, usually within about 30 to 40 minutes, or you'll get information about when you can get that connection made. Our partners, Cayuga Health System, is based in Ithaca, New York. They're servicing Cornell, Ithaca College, Wells College, Tompkins County Community College, all the local schools in the area. They've developed this system, and they'll be providing our telemedicine service and making the recommendation of what happens if you happen to get a red light on your cell phone during the daily screening. All of this is meant to keep people from going to class who might be possibly spreading disease. The questions are pretty basic. Have you tested positive for COVID? Or have you been in contact with anyone who tested positive? Or have you experienced any symptoms of COVID in the past 14 days? Or have you traveled to any of the states on the New York State restricted list of hotspots for which quarantine is required? And so these questions will determine whether you get to go to class or get to be considered by the telemedicine for further examination of what those symptoms are. Is it perhaps an allergy that you're experiencing and you're reporting, or perhaps some other reason you have the condition you've reported on the screening? Very likely everyone will be screened negative, but if the telemedicine says you really should get a test, stay home, don't go to work or class, we want you to follow, we want students to follow whatever instructions are provided. So it's possible that some people will come to school, be screened at 8 in the morning for class, but around 3 o'clock they might start feeling ill. The exposure might have happened or might be setting in. We want students who become ill after they get to school to make sure they let us know. Contact my office. We want to get them connected with the community medical center and make sure they're getting help as quickly as possible. So if anyone gets sick after they've been screened, we do want them to let us know so we can get them supported. The testing is again provided by the Cayuga Health System. We mentioned that we're testing everyone upon arrival. We also test people when the screening recommends that, as I've just described. There's also a procedure to know how our campus is doing at keeping COVID contained. And through that, we're testing everybody, faculty, staff, and students every 4 weeks. That'll give us about 25% of the campus every week. So we'll be able to see where there are any pockets of outbreak that we need to be paying attention to. So we are requiring everyone to participate in the testing. It's the PCR nasal test. It's a little deep in the nose. It's not that, because it's most reliable. We know there are simpler tests that are out there, but they're not as reliable. And we want to have the most reliable tests provided. And the Cayuga Health System is working with us to provide those testing on a regular basis. Before I go further, Chris, any questions coming up about testing or screening?
Well, yeah, I was wondering if maybe we could just walk through what it would be like for, let's do one example of a new first-year student and then an example of a upper class student coming back. I think we just want to clear up a little bit of, when a student needs to go into quarantine and when they don't, versus if a student comes to campus and gets a test, they only have to go into self-quarantine in their own residence hall room just until they get the test results back. They do not have to quarantine for 14 days, correct?
Correct.
Right.
The testing upon arrival, they tell us we could get results same day or within the 24 hours, depending on what time of day they get the test.
Mm-hmm.
It's pretty quick turnaround, so we're confident we'll know soon after you arrive whether you have any issues that need to be addressed.
Mm-hmm. And then Dodge North is only being used for students coming from another country or one of the states on New York's list, correct?
That's correct.
Okay.
That's where the governor has required us to put into quarantine anyone who comes from those hotspot locations.
Mm-hmm.
And that is a mandatory 14-day quarantine that we have to provide.
Right.
And we do that on campus. We provide meals to everybody. There's no added cost for anything. And we'll talk in a minute about some of the support also
Great.
that'll be provided.
Great. And I think it's also worth noting for those who are not from the area, Cayuga Health System runs the main hospital in Ithaca and I believe also the one in Watkins Glen. They've spent millions of dollars expanding their own testing capabilities. And one of the reasons that we can get these results back so quickly is because they're not having to send it out to another lab and then waiting on the lab to send the results back. Am I accurate in that, Dean Kenyon?
They are operating their own lab, and it's a very quick turnaround.
Because, we've all been reading the media about other places, other labs having 5, 7, 14-day delays, which makes those tests almost useless. But, our healthcare partner assures us that, 24 hours is really what they are aiming for, if not sooner.
Can I just add one more thing in terms of the 14-day quarantine? Isn't just for students who are arriving to campus from for the first time from one of those states, but should a student leave campus for some reason and go visit family or friends, and that state then that they're visiting is on this governor's list,
Mm-hmm.
when they come back to campus, then they have to do another 14-day quarantine.
Mm-hmm.
Good point. Good point. So be aware of that if you're in one of those affected states.
Mm-hmm. And then after
the list is constantly.
Oh, sorry, Cindy. Go ahead.
And the list is constantly changing, so that's something else to keep in mind.
Mm-hmm. A related question in terms of going off campus from a few people is, some people have asked about, can students leave campus to visit family, to go to Ithaca, to go to an off-campus job? We are allowing that. We certainly want that to be kept to a minimum. Certainly any contact anywhere on campus or off certainly brings a risk, but we're trying to minimize that risk as much as possible. But we will allow students to leave campus for those reasons.
And be aware that this is an area that has a very low rate of COVID in New York State. There's more concern about students bringing illness to the community than there is about students getting ill by going out in the community. And so we are asking students to be respectful of the community in which they are living, Aurora, wearing masks when they're in the village, or if they go to Auburn or Ithaca, make sure they wear their masks or do the social distancing as required. This has to be a shared effort, but I think given our metrics in this area, we have a pretty good chance of just having this be a very, hopefully, well-contained problem.
One more
Just for an
question.
example,
Oh,
Dean
go ahead.
Kenyon, you know, if a family is in Aurora or students and you want to go to the Fargo, all of us, I've been there several times. You wear a mask, you go to the Fargo, they have you line up outside, they take you to a table, you sit down, you can sit either outdoors or indoors, you can take your mask off to eat, then put your mask back on to leave. So, you know, everybody just needs to be really cautious and attentive to what's going on around them and following these very simple requirements.
Thank you, John. Was there one more, Chris?
I just wondered if you could speak to, you know, why our healthcare provider is doing the PCR tests and not any other type of test, because there are certainly several types out there.
This is the test that they have determined to be the most reliable and effective at assessing whether a person has the illness or not. Other tests have apparently shown less reliability, and so we wanted to make sure we went with the what is most reliable. So the testing may lead to contact tracing if there's a positive result. Contact tracing is handled by the Cayuga County Department of Health. They effectively become responsible for the individual who tests positive, whether it's an employee or a student. They would issue instructions for what kind of restrictions on movement and monitoring might be needed. They will ask the person who tests positive who they were in contact with. And so subjects of contact tracing will be identified and notified that they need to be investigated as well. And if the Cayuga County Department of Health requires, we will quarantine folks in their home if they want to go home and it's feasible for them to go home to spend their time waiting to see how this illness is going to transpire. We would encourage that. We want them to be with you as much as possible if they're ill. But if that's not approvable, perhaps someone had to fly on a plane or take a bus. The Cayuga County Department of Health wouldn't allow that. So we have space for students in Dodge North to spend the quarantine period. The setup in Dodge North is a suite arrangement, suite style rooms, sharing a bathroom, 4 rooms in 1 bathroom. So we would have no more than 4 people in a suite. Each student would have a bedroom, private bedroom, and they would be given instructions for how to keep their suite clean and disinfect the bathroom, things like that. We'll try to limit it to 1 per suite, but if our numbers require, we'll go up to 4 students in quarantine. We have made arrangements for additional quarantine locations. For example, at the start of the year with the out-of-state international students might occupy more quarantine locations than we have in Dodge North. We can quarantine students in Quality Inn or the Gould Hotel in Seneca Falls. It's really just for students who are not cleared through the daily screening and the telemedicine advises them to go into quarantine. Students who might be identified through contact tracing as a subject of a person who tested positive that needs to be in quarantine to see if they've been exposed and developed symptoms, or if students have come to New York at any point in the academic year from the states that are on the list of restricted states. So that's the only reason someone would get into quarantine, and we'd be working to provide support that I'll explain in just a minute. Isolation is for persons who have tested positive, and we need to make sure they don't get exposed to anyone else in the community, or perhaps they have severe COVID symptoms and haven't been able to return home to receive care in their home location. So these are a little more controlled spaces, no more than 2 students we're trying to keep the isolation exposure as limited as possible. So this is a unique experience for any student who's going to experience isolation or quarantine. They'll be getting daily health checks, both on their physical and mental health status. Food will be delivered according to the meal plan schedule. People who are delivering the food will have extra protective equipment. Students can order online for the food of their choice for that day. There's going to be remote learning and academic support provided for courses, so students in quarantine can take their courses remotely. We're creating a peer ambassadors group that will be supporting the students who are in isolation and quarantine, make sure they stay connected with their peers. We can learn about any problems they might have, any support they might need. And all of that will be provided whether they're on campus or if they happen to need to go to Seneca Falls quarantine locations. So we will be doing our best to support anyone in isolation and quarantine. Our partner with the Community Medical Center will be responsible for the monitoring daily health and making sure any additional medical care that's needed is provided. And if there's any emergencies, the Auburn Community Hospital will be working with us to provide emergency care in their COVID unit that they've created for this purpose. So we have a plan ready for learning about who might need quarantine or isolation and how we're going to support them. Let me see if there's any questions before I go on.
Yeah, there actually was a question about mental health counseling. Is you know, the medical center does provide mental health counseling. It's my understanding that that is happening online and has been since spring. Are they continuing to do online appointments for that, Charles?
Yes, they will be providing counseling through the online mechanism they've been using since the springtime. Mm-hmm. And we're also looking at how we might expand our number of counselors available and the time of day that they're available through some other telemedicine providers that we can look at.
Okay. And then another question was, other than COVID-19, would seasonal flu also trigger a quarantine? And I think what Paul means by that question is, would symptoms of the flu mandate, you know, a student having to leave campus?
Well, that's definitely something the telemedicine and the healthcare providers will help assess. That's the reason we have the symptoms lead to a medical assessment so that it can be determined whether this is a flu-like symptoms or COVID symptoms. They're very alike, so it's quite likely that the health provider will recommend a test just to eliminate the possibility of COVID. And where we have such a fairly quick turnaround, 24 to 48 hours on the test results, they might only have to quarantine for an overnight, maybe 2 at the most.
However, I would add, Dean Kenyon, that I think everybody should contact their healthcare provider at home and strongly consider getting a flu shot. This season, we'll have a flu shot clinic on campus as we have in the past, but I think you want to do everything possible to protect yourself against the flu, the seasonal flu.
Absolutely, and they should be maybe available in your community before you come to campus. So that's good advice. Anything else, Chris?
One more is that what if the student has no underlying medical condition but would still like to learn remotely? Is that something that the student should talk to Emily Madison about, or what's the protocol there?
Yeah, so as I mentioned earlier, students could still submit those requests to my office, and I'll work with them to review the situation and figure out how to move forward with that. So yes, they can still submit requests even without the medical condition piece, and I would work with each student to figure that out.
Thanks, Emily.
Thanks, Emily. So we're going to be keeping track of the results from our screening and testing to know where we stand as a community. We have set some metrics that we're going to be monitoring. We are looking at a 2% measure of 2% or fewer students who complete, or students, faculty, and staff, everybody who completes the required daily screening protocol. We'll take a look at the number of people who completed that day's screening, and we're trying to keep the number of people not cleared below 2%. So for example, if we had a day where 550 persons completed the daily screening, that's students, faculty, and staff, we want our community as a whole to have fewer than 11 persons not cleared to enter campus. That's about 2%. So we're trying to set some metrics that will tell us whether we're doing a good job of containing the virus. So we're trying to stay below 2% on a 7-day rolling average of screening results for the screening. And we're also looking at the testing results. And there we set a 3% or fewer persons obtaining a positive PCR test on the daily results from testing that might occur. So if we had 198 test takers in a week, 3% of that would be about 6 people. So we're going to be tracking the test results to make sure that we're staying below the 3% threshold that we're using as an indicator that there's something needs to happen. And these indicators will tell us that there's another step that needs to be taken on campus. We have to respond to some elevation in these metrics. Response to elevation at a low level, where we have 10 or fewer positive test results, would be more precise, what they call a precision response. We can identify the parties involved and contain and isolate and remediate that pretty efficiently. If we get between 10 to 30 positive cases, we'll have to take a little more aggressive approach, but we ought to be able to identify the locations and the people, remediate any disinfecting that might be needed, and also isolate and separate people who have the illness from the rest of the community until they can get better. If the numbers go up over 30 cases, we try to ramp it down with perhaps stopping a residence hall from going out of their building, quarantine within a residence floor or a residence hall, if that is the location where the high elevation of cases is occurring, or if there's an academic program where there's a high number of cases, we'd want to look at what's going on to create that high number within a certain group, and we'd be trying to isolate that group until they can get past the testing and be returned to campus. And the final 2 metrics, if it becomes widespread on campus, over 50 cases, exceeding our capacity in Dodge North to contain people in isolation and quarantine, we'd be using our Seneca Falls location, but we'd be looking at how do we start to shut down some parts of the campus. And that would really be required if we become what they call uncontrollable, needing a shutdown where we just lack the facilities to be able to isolate and support everybody who is evidencing the disease. In this semester, we would have to shut the campus down and make sure everyone gets home safely. So these are some of the metrics that are going to guide us in terms of responding to what we learned from the screening and test results. And all of this is to say that it requires a lot of work, a lot of collaboration, a lot of communication, a lot of teamwork, people working together, students, parents, faculty, staff, all of us in the village of Aurora, all of us working together to contain this outbreaks of COVID in our community. And if we do that, and we've done it before, we can do it again. We are a good community of people that care, and that caring will bring us together to do the right thing, keep our community safe. So with that, we have time for more questions, Chris?
Right. I think we've handled most of the questions that have come in already. We have a nice comment. Thank you for your hard work and great concern. And I want to commend Dean Kenyon and President Gibraltar and everybody. It has been a lot of work this summer, but I think, you know, we've gotten to a point where we're We've got a solid plan. I mean, for example, what Dean Kenyon just presented about shutdown metrics, this is not just an on-off switch. You know, it's not like we have one suspected case and everybody has to go home. It is responsive to the data, and we're keeping tabs on Governor Cuomo's recommendations, the CDC, the New York Health Department. We're working closely with the Cuyahoga County Health Department. And, you know, we're certainly doing our best, but we're confident that this will work. There is a question, can the students get the flu shots in the health center?
Yes, we will be offering flu clinics on campus.
I just want to add in conclusion, thank you all for your confidence in Wells, and thank you for your willingness to send your child to us during these extraordinary times. I also want to add that I believe that the strength of our community will help us to stay healthy and to stay safe. And everybody has a personal responsibility to work together, to police themselves, to make sure they're doing what's expected of them. We don't want this to be punitive. We want it to be positive. We want everybody to work together, to care for one another. And if we do that, I think that we can succeed. So please, parents, before you get in the car with your son or daughter, please sit down and have a heart-to-heart conversation with them. We believe we can do this, but if mistakes are made, if people don't comply, it's possible that things could go really bad. So please have a heart-to-heart conversation with your child and plead with them, make them aware that everybody's individual action matters. Thank you all so much. And we look forward to seeing you in a very short couple of weeks. If you have any other questions, please contact Dr. Kenyon, email any one of us. We'll be happy to respond and let you know the answers to any unanswered questions.
Thanks, everybody.
Take care.
Thank you all.